PRP, with microneedling of the face, is a cosmetic treatment used for skin rejuvenation, combining the benefits of microneedling and platelet-rich plasma PRP therapy. Here's a breakdown. Indications: fine lines and wrinkles, acne scars, hyperpigmentation, enlarged pores, skin laxity, uneven skin tone and texture. Method of anesthesia. Topical anesthetic numbing cream is applied to the face to minimize discomfort. It is typically left on for 20 to 30 minutes prior to the procedure. Procedure steps. Blood collection. Blood is drawn from the patient and processed in a centrifuge to separate the PRP from red blood cells. Preparation. The face is cleansed and the topical anesthetic is applied. Microneedling. A microneedling device with fine needles creates controlled microinjuries on the skin. PRP application. PRP is applied topically over the treated areas or injected into the skin, enhancing the healing process by stimulating collagen production. Safety precautions. Use sterile instruments and ensure proper sanitization to avoid infection. Avoid the procedure if there is active acne, open wounds, or skin infections. Post-treatment care includes avoiding sun exposure, rigorous physical activity, and makeup for at least 24 hours.